Thank you, everyone. Thank you for clicking on our educational piece. Vasolabs is a provider of mobile ultrasounds, and we provide this service mostly to concierge or private physicians, people who specialize in heart attack and stroke prevention, and mostly have the time to talk about heart attack and stroke prevention. It's their specialty. It's what they do. They'll usually limit their patients to a few hundred patients, their practice to a few hundred patients, to make sure they do it right. And the crux of the diagnostic is looking at your arteries. You can see if the walls are inflamed, if they're thick, if they're beat up and tired. The lining of the walls gets thicker as it gets older, as it becomes inflamed. And this is the biggest killer in America. This disease debilitates, makes the most widows, takes the most limbs. It's really dangerous. And just an easy way to know if you're at risk, if any of the risk factors that we will talk about, or if, for example, if you talk to your doctor about erectile dysfunction and he hasn't started a full-scale investigation into your cardiac health, unless there's a really other compelling reason, you may need to spend a little more time with your physician on this disease. It kills the most people in the United States, far and away from any other disease. And Vasolabs can help you figure this out. So here's one of the reasons why is the blood. This is a video of how blood goes through the artery. And for example, if you have bad oral bacteria, if your gums and teeth aren't clean from bacteria, that gets into your bloodstream. And when it's in your bloodstream, you can see here that the blood does not flow evenly. It bounces around the artery. And if there's a really caustic, really negative bacteria in your blood and it hits the walls and it buries into the walls, that's the start of plaque buildup. And other things can happen getting into the wall. There's other diseases. If you smoke, this pushes those nasty particles into your arteries. High blood pressure causes damage. And it causes not the blood here to get thicker or worse, but the lining. That lining gets thick, gets inflamed, it can fill up with a waxy, pussy substance and cause these pimples in the artery wall, plaques. And the plaque can pop like a pimple. And causing problems like that can really make it worse for everyone. So this is the report we'll give you, or this is part of the report we'll give you. We'll tell you that the artery age gets worse as you get thicker. Your percentile gets higher as you get thicker. Thinner is always better. Smaller is always better on this report. And you can do it year after year to make sure that your arteries are getting thinner and healthier, like you can see this patient getting. Here's another video of how it happens. And remember, any of these risk factors can make or be a flag for making it worse. Diabetes, your perio disease. If you have any pockets in your mouth, if your dentist has mapped any pockets in your mouth, you definitely need to have this looked at. Please spend the time, talk to your physician, and make sure you've got this buttoned up. This test is used by the American Heart Association, and they recommend it using the same machine we use to look at babies. It's safe, it's reliable, and we can use it to look at this disease. And we can use it to look at specifically your disease. This will rule you in or rule you out for disease like no other test. It is a powerful diagnostic. We will include the most people. There's other testing like coronary heart scans where they measure how much calcium's in your artery. And that test is really wonderful. You can find out how much calcium's in your heart. And based on how much plaque there is, they correlate. But if you want to find the disease earlier than that test would, the ultrasound of your artery, the carotid IMT, is a great reason to use this test to find out what it is. Here's what the finished report will look like. On the top here, you can see, we'll show you how much plaque you have, and if that plaque is soft and ready to rupture, or if it's getting heterogeneous or calcified, then you'll know that it's getting safer and more buttoned up. We'll also tell you your vascular age. You have the arteries of a 70-year-old or 50-year-old, and we'll also tell you your percentile. And eventually, of course, you want to be less than 75th percentile. You want to keep it low. You want to be healthy. We'd love to offer this. We offer classes where we can introduce you to physicians who will give this testing and education to you. We have further testing and education we'd like to introduce to you. And we just want to help you feel better. The magnitude of this disease is huge. It affects most people. It's expensive, and it causes a lot of pain and sorrow. We can fix it. It's aggressive. Aggressive, thorough follow-up can mitigate your risk. Vasolabs is here to help you. We want to make sure that you can have what your doctor may not be able to give you time for. we can show you what you may not have time for. Your physician has a whole universe of knowledge he's got to stay on top of. Being an expert on cardiovascular disease is elusive. It's hard. To be an expert, you've got to be in the top few percent. You've got to have the time to spend specifically on this. You've got to know a lot about coughs, colds, sniffles, flus. But cardiovascular disease is a whole other world. And they can know a lot about it, but they may not be the best. And you deserve the best. Come learn. Thank you very much.